It's time for the MD West 1 Medical Minute on Boomer Radio. Today, we're talking with Dr. Wesley Cheng. Doctor, I have hip pain. How can I tell if I need to see an orthopedic doctor as opposed to waiting it out?
Usually I think people will experience joint pain every now and then, and it should resolve around 2 to 4 weeks. But if your pain is lasting longer and you're having pain with weight bearing, and it's not getting better with over-the-counter medications and time and rest, that's something that should be evaluated by an orthopedic specialist to check it out and see if an identifiable cause can be ascertained. I think a time-wise basis as well, you don't want to wait on something so long that it could cause further damage to your joint in the long run.
Doctor, what is hip arthroscopy and what kind of conditions does it treat?
Hip arthroscopy is scope surgery for your hip joint, and arthroscopy has been used commonly for shoulders and knees in the past. Hip arthroscopy is an emerging surgical procedure to allow minimally invasive surgery for the hip. It can treat a variety of different conditions such as labral tears, impingement syndromes, or snapping hip syndrome. Labral tears are a cartilage tear in your hips which can cause deep-seated pain. Impingement syndromes are basically your ball and socket joint of the hip is not so perfect. So you don't have a perfect ball and you have lumps or bumps which can cause pain. Snapping hip is when people experience some kind of pop or snap in their hip and pain deep-seated inside their hip afterwards.
How do I know if I'm a candidate for hip arthroscopy?
Hip arthroscopy is used for patients who have hip pain, but not necessarily pain caused by arthritis or severe arthritis. So if you're at the point where you do have significant hip pain, but you've been told by a hip specialist that you're not a candidate for a total hip because your cartilage levels look good, hip arthroscopy can be that procedure avenue which may alleviate your pain. It is something that treats the cartilage and soft tissues of the hip rather than trying to do a total replacement of your joint.
What are the benefits of hip arthroscopy as opposed to other treatments?
Hip arthroscopy is a minimally invasive surgery, so it involves making small incisions and utilizing a small camera, small tools to do the work. Traditionally, hip problems were treated with an open procedure, so a large dissection, and which may lead to more complications. People undergoing hip arthroscopy can range in from ages of their young teenagers up until 50s or 60s, depending on the condition of their hip. Some of the benefits of hip arthroscopy is less pain afterwards since the incisions are smaller and faster recovery times. Also, hip arthroscopy has goals of trying to get people back to their everyday activity, even high-end activities such as running.
Doctor, what can I expect after the hip arthroscopy procedure? Recovery time, pain, etc.?
You can expect a weight-bearing restriction with crutches for about 2 to 4 weeks after the procedure. Pain-wise, most pain starts to get a little bit tolerable or more reasonable at 2 weeks after surgery. The surgery is done as an outpatient procedure, so you would come in and have surgery and go home the same day. At MD West 1, we perform this procedure at multiple locations such as Midwest Surgical Hospital or Methodist Health West Outpatient Clinic. Hip arthroscopy is a surgery that can help with many joint and hip conditions that don't require a joint replacement.
For more information or to make an appointment, visit mdwest1.com.